Hello, I'm Dominic and I'm an MS reporter for Shift MS. In this series, we will be talking about a really important issue: how the pandemic has completely transformed the way MS care is being delivered. Recently, Shift MS put out a survey to the MS community across the world to find out exactly that. We're using the feedback you gave us about what is working for you and what isn't working or needs some tweaking to produce a white paper for MS healthcare professionals to use to help them make the best decisions about your care in these new times. What is a white paper, you may be wondering? And that is an excellent question. A white paper is a guide to inform the people in a field, in this case, the MS healthcare professionals, about the complex issues faced, in this instance, by us, the patients. This helps them to better understand the patient point of view and make decisions that take our views and feelings into account. So let's go over to our first interview with Professor Gavin Giovannoni in the UK. If you could introduce yourself, please, Kevin.
So I'm a neurologist. I work at the medical school, Barts, and the London School of Medicine and Dentistry, where I run a research program into multiple sclerosis. But I'm attached to the NHS and I work in the neurology department of Barts Health, and I'm based at the Royal London Hospital.
Maybe you could tell us how you feel the risk to MS has changed in the 6 months since it all hit in March.
When the pandemic first started, in terms of the first wave, we had to, as a community, make assumptions based on scientific principles, or we thought they were based on scientific principles. And I think in retrospect, a lot of the assumptions we made have proven to be incorrect. I think the good news is that there have been large numbers of registry studies across the world in different countries, and they've also combined their data to show that actually people with multiple sclerosis in general do not appear to be at increased risk of acquiring COVID-19 or getting COVID-19. I think what's panned out is the same risk factors that are playing out in the general population are playing out in the MS population as well. So this would be older age, comorbidities, that be hypertension, diabetes. In terms of MS, so it looks like people with more advanced disease, much higher disability scores, people that are very disabled are slightly at increased risk, but that's probably related to the fact that they're getting exposed to the virus more commonly because of carers coming in and all that. In terms of disease-modifying treatment, we came out with assumptions that a whole class of DMTs were unsafe, but I think the overall message is not. The only one that looks like it increases your risk of getting COVID-19 and potentially severe COVID-19 are the so-called anti-CD20 therapies. So these are the treatments that deplete B cells. The other thing that has emerged from the one database, which is the Italian database, is that exposure to high-dose steroids, and we know we use it in people with multiple sclerosis to treat relapses and also to prevent infusion reactions for some of the antibodies we give intravenously. Those particular individuals were much higher risk of getting admitted to hospital or having severe COVID-19. And I think that's pretty clear now, and that's one of the reasons why we try and reduce steroid usage in our practice at the moment. And I think that's going to continue for a while. So I actually think overall we shouldn't change our advice. People should probably go ahead and make decisions about their treatment as if COVID-19 wasn't here. And whatever treatment they've been offered, they should go ahead and choose whatever therapy they want. So I think it's very reassuring data.
We all know how much it's changed, how much telemedicine, you and I have spoken about this before, has suddenly sort of come onto the scene. What adaptations have your team made? And what's working for you and the patients, and what's maybe not?
So while the pandemic was ramping up, the advice we were given is to try and reduce exposure of our patients to us, for example. So that's why we had to put in place remote telemedicine, video consultations. Strangely enough, patients have actually, a proportion of patients have liked it a lot. And so I don't think we're going to get rid of them. And similarly, we still got social distancing. So we can't actually go back to, what we were before. We've had to reduce the amount of face-to-face consultations. But that doesn't mean to say we can't deliver a very good service. I think what my personal opinion is, time is brain. and the idea of getting people through diagnostic pathways as quickly as possible, getting them onto treatment as quickly as possible, monitoring and escalating treatment as quickly as possible. Those things shouldn't change. So if we're devising a healthcare system now where there's going to be a hybrid model of face-to-face and telemedicine or digital medicine, some people like to call it, the principles that underlie our management of the disease should not change. And that's going to be the challenge, is how do we get systems in place to make sure we're not delaying diagnosis, delaying access to treatment, delaying access to monitoring.
Gavin, I was wondering, one of the things our survey told us, because it was a global survey and the Shift MSers go across the globe, frankly, was a common theme was a lack of unified information, call it, or guidance for the people with MS from their healthcare professionals. And I didn't know what your thoughts were, because as a patient, it's super confusing when somebody swears blind that they're told one thing and you have heard another.
Yeah, I think the reason for the lack of standardized information, because there wasn't any evidence base, so healthcare professionals, we like to practice evidence-based medicine. And so because there wasn't any evidence, this was a new virus, a new disease, everybody's opinions were different up front. I think people are now gravitating towards a common theme, but even now there's different opinions. And I mean, one of the lessons we must learn from this is to try and educate people with multiple sclerosis, their families, the general population, that when there's uncertainty, they must appreciate there's not going to be any certainty in the guidelines they're given. I think what also came out is we don't really have a mechanism to communicate with all our patients by hitting a button. The idea of having to send out letters to everybody, which is kind of what the NHS works on, is the old postal service is a flawed model. And we're not allowed to communicate by emails, in inverted commas, unless we get consent from the patients and use a secure emailing system. We now do have a secure emailing system, but it's not something we can hit a button. So I think one of the things we should learn is we should all develop systems for being able to communicate with our patients very quickly. And I think we'll put that in place. One of the learning lessons from this is we do need to communicate with patients using modern technology in a very efficient and appropriate way. And I think if we did that better and made sure our databases were all up to date and people were all on our mailing systems, I think it would have been a lot better. That was one of the criticisms, is not all our patients had access to the information we were putting out.
We run the risk of marginalizing. There's always a small amount of people who don't enjoy the kind of access that many of us do. But if all you've got is a pay-as-you-go phone with a limited data plan, it may be much harder for you to access the internet, than somebody sitting in front of a laptop like we are now.
Yeah, so I think one of the things is maybe we should then decide to go for the lowest common denominator. Let's say the lowest common denominator is an SMS text, for example. It's probably an older technology than anything else. And we do have systems in place for SMS texting our patients. So maybe we should just say, well, let's start off with the lowest common denominator and SMS text everybody using a standard message. And if they don't have a registered mobile phone number that can take and get an SMS text, then those people should be contacted, via landline, whatever, or postal service, and try not to leave any patient. But I completely agree with you. This was one thing the COVID-19 pandemic has shown, is that there is an enormous divide at a digital level between the haves and have-nots, and the have-nots have been left behind.
Some of these changes will be with us for going forward, and some of them are going to fall away as we all learn how to get better at doing this.
Yep, I completely agree with you. And there's also really good news happening, outside of MS, in the sense that it's quite clear now that even if you get COVID-19, the chances of getting severe COVID-19 seem to be getting less. And survival rates have gone up. We now have emerging treatments. We're anticipating vaccines very soon. So everything is looking very positive. So I think we need to take away from this a positive message, not a negative message. Things are we're in a much better space than we were 6 months ago.
I thought that was a really interesting chat. Maybe some of it gelled with your own experience of your MS care and how it has changed during the pandemic. Look out for our next episode when we talk to a neurologist from the US about how MS care is adapting to the new circumstances over there. And please don't forget to like, share, and subscribe to the MS Reporters channel for more MS news. and we'll see you next time.